All right, well, then we will get started. Thank you all for coming tonight. This is our first info session, so we're really looking forward to it, and we're grateful to have so far 34 people here. That's wonderful. So first, I'd like to start out with our program's mission statement. Not just to say it, you all can read it on the website, but I want to point out a couple things. So our mission of the program is to prepare physical therapy practitioners who embody lifelong learning, collaboration, and leadership in order to improve the health of individuals in our region and society. So this mission, first and foremost, in terms of what lifelong learning means, in any healthcare field, research is changing. In physical therapy, what we did 20 years ago, or even what I learned in school 14 years ago, is different than what we teach in the program now. With the advancements of research, we have to stay up to date. So it is important for our students to learn to become lifelong learners. What you learn in PT school is not the end of your learning. The way I treated patients when I first graduated is not the same way as I do now because of new research. In terms of collaboration, I'll talk about this more, but we really value collaboration with other healthcare providers and learning how to work as a team. So that's what that's pertaining to. And then being a leader and a steward of the profession, ultimately to improve the health of not just individuals of our region, but also of the greater, larger society. So those are kind of our three big themes of our mission statement: lifelong learning, collaboration, and leadership. And we really hope to instill those attributes in each of our students by the time they graduate. Here are pictures of our faculty. So we have 8 core faculty members. The bottom right, Dustin Barrett is new, so his picture is not yet on our website. But a couple things I'd like to highlight is that majority of our faculty all have specialty certification in a particular area of physical therapy. So for example, Dr. James Boone and Dr. Michael Bourassa both have orthopedic certified specialty. Dr. Carr Bonowitz has pediatric certified specialty. Dr. Mehta, a geriatric certified specialty. I have the neurologic specialty. And then Dr. Schroeder, cardiopulmonary. And then Dr. B. Owens on the bottom left, she's a certified hand therapist. So that's a further training. And then also Dr. Owens is our program director as well. And our new hire, Dr. Barrett, also has his orthopedic certification. So the reason that matters is because we truly have the experts teaching within their field. So for example, my specialty is neuro, and I teach all the neuro classes. Dr. Boone and Dr. Barrett are both orthopedic, and they focus on orthopedic classes. Dr. Bonowitz teaches the pediatric track. Another thing about our faculty is that they are very open, collaborative. They have an open door policy. Of course, we all have office hours on our door, but you will notice if you come for a tour at some point that office doors, if we're here and our doors open, it means you can stop by at any time. And I think that really kind of breaks down some barriers that can happen between faculty and students if we have a more open door policy. So they're very approachable. We have an updated curriculum that we implemented now 2 years ago. So we're going through the second cohort of this curriculum. And the biggest change was that we reduced it from 9 semesters to 8 semesters. So our students will be graduating 1 semester early. So they will be graduating in August each year. We did not take out large things from the curriculum. We slightly reduced the number of clinical education weeks, but we still have far more weeks of clinical education than what is the minimum. And so the other thing with the curriculum is some of the content has been updated. Like I mentioned earlier, as research gets updated, curriculum content has to be updated as well to meet that change. Another perk is that we value interprofessional education, or IPE. And what that is that our students All of our students are on a track that includes doing some small courses in conjunction with other health profession students, such as occupational therapy, speech language pathology, audiology, medicine, nursing, and pharmacy. And they have a couple meetings each semester. And the way that program works is their content and what they're learning kind of grows with each semester. So they're growing as a DPT student, but they're also learning more and more about working as a team, and in a team in a healthcare field. And then lastly, the one thing I want to mention is that we also have a residency program within our DPT program. And what I mean by that is that a residency program is something that one can choose to take, a path to take after graduating from physical therapy school and getting a license. So you have to be a licensed PT to do a residency. However, by having it under the same roof as our entry-level DPT program, there's a lot of overlap. And what I mean by that is our residents work as lab assistants in our entry-level classes. So then residents are mentoring entry-level DPT students. And then on the other side, these entry-level DPT students are getting more awareness and understanding of the residency pathway. So if someone is interested after their entry-level DPT program in pursuing a specialty, like I mentioned, many of the faculty did, that starts with a residency program. In terms of our facilities, I'm actually going to start at the bottom. So we renovated our entire floor, all the PT rooms and offices a couple of years ago. They're bigger, brighter, everything is new. So it's a very nice space if you haven't seen it before. Hopefully, fingers crossed, we're working on a virtual tour that probably won't be ready for a couple more months, but hopefully soon we will have that up on our website and PTcast to see. We also have two other unique facilities I'd like to highlight. The top picture is a simulation lab. So you can see in this picture, there is a mannequin on a hospital bed, and that room actually has 4 bays that look like that. And we set that up to simulate an acute care hospital or a skilled nursing facility so that our students are practicing in the environment that they're going to be actually doing their clinical rotations and ultimately possibly working as PTs in. And that room is pretty nice in terms of we can set up a simulation scenario where the mannequin has an IV, the mannequin has a catheter bag, you can see different machines in the background. So it's very realistic. And then the bottom picture is from a class from a couple of years ago in front of the anatomy lab. And this is pertaining to the second bullet here. Our program still does full cadaver dissection during anatomy, and that's thanks to a donor program and the College of Medicine here. Many PT programs have moved away from cadaver dissection. It's a lot of work, it's expensive, takes a lot of resources, but we still continue to value the learning that can happen from taking anatomy with a cadaver dissection. Also in our program, we often get asked about research opportunities. There is a plethora of them in the program. We have a research track that all students are required to take as part of the curriculum. However, as they start out on the track all as one, but then they are able to kind of venture off into topics that they prefer or maybe more suited to learn more about. So in their second year, the students are given topics that the faculty are currently working on in terms of the faculty's research, and the students get to pick which one of those studies is most interesting to them, which one they would like to help with and learn more about. And this has culminated into multiple presentations at the regional, state, and national level. Both of these pictures are of faculty and students presenting poster presentations at national conferences. We are very much connected with our local community here in Johnson City, Tennessee. Our students volunteer at multiple different fundraising events for nonprofits around the area, such as Miracle League and the Crumley House. Our students attend what's called Rock Steady Boxing, which is it's an exercise program for individuals that have Parkinson's disease. The Scarecrow Skedaddle and also Camp Cliffview are two others that we do a lot at. The picture at the bottom is at Miracle League and then with a student. And the picture on the right is at the Scarecrow Skedaddle. So that was all the serious stuff. We have more serious stuff later, but I do want to mention that we like to have a lot of fun at the same time. Many of our students choose to participate in intramural sports. Sometimes it's taken very seriously, but it is a really good way for them to grow as a team and as a family, because in PT school, you get to know your classmates very closely. We also do annual tailgates. We have 2 or 3 lined up this fall already that we'll be participating in. The bottom right is a past student who was in charge of the grill at one of the tailgates. We often have a Halloween dress-up day, which I don't know if we're doing this year, but many years in the past, we've had a contest for the best Halloween costume. And then our students organize and host the physio ball in the summer every year, which faculty do not attend. And my understanding is that it's an excellent party that you don't want to miss if you're in PT school. We are located in Johnson City, Tennessee. So the East Tennessee region, the Appalachia Mountains. Some perks of this area of the country are that we really have 4 climates. Our summer's not too hot. It's not like Florida. And our winter is not too cold. I think we're in a great spot for climate. There's definitely a reduced cost of living here compared to some of the larger cities around us, such as Knoxville, even Asheville, Nashville. Transportation is very easy here. We do have a bus system. Most of our students drive, some ride their bike to school. There is a lot of downtown music festivals, restaurants, shopping, that sort of thing. That's very close to where the university is. And outdoor recreation is also very popular in this area. In the picture, you can see the mountains in the background. A lot of people here partake in hiking, mountain biking. Pickleball is really big right now. Just anything outdoors. In fact, our students put together I believe a pickleball contest this summer for one of the classes. Okay, that is it for me. So I'm going to hand it over to Melanie, who will talk more about our admissions process.
Hi, everybody. I'm the admissions counselor, so I'll be working with you as you're in the application process for our program. And so as you can see on the slide, each year we admit 36 candidates to our program. It's a 3-year program and it starts in January each year. So right now we're taking applications for the spring 2026 start. And we have a priority deadline of October 1st and then a final regular deadline of March 1st. And our application process does require 2 different applications, the PT CAS application, which many schools use, and then we have our in-house ETSU grad school application that you also have to complete. So it's kind of an overview of the process. On the next slide, this is kind of a picture of what a competitive application looks like. Our minimum GPAs are listed on there, but as you can see that the average overall GPA and the average prerequisite GPA are higher than the minimums. And some questions I've been getting about the average prerequisite GPA lately, that's just, we're taking the prerequisite classes required for our program and taking a separate GPA of just those classes. The overall GPA would include GPA from each institution that you attended. So that's kind of the difference between those two. Also, our faculty like to see an average GRE score of 300 between the verbal and quantitative sections, but we don't have a minimum. On the next slide, these are the prerequisites I was mentioning. So these are the classes that you have to take to be eligible to start our program. 3 credits of statistics, 8 credits of biology, 4 majors. That's important. Intro to biology in some cases won't work. So we need to make sure that it's the right level class. Same with chemistry and physics. Both of those are also 8 credits. Human anatomy and human physiology, we now accept A&P1 and A&P2 for those 2 requirements, as long as they're taken at the same institution. If they're taken at separate institutions, they might still be accepted, but our faculty want to look over your syllabi, and if that's the case. We also have exercise physiology, and then 6 credits of psychology. So as you can see on here, GRE is required. We have 3 letters of recommendation, and including 1 from a current physical therapist. And shadowing it in a variety of settings is strongly recommended, but in our application, we don't actually require any documentation of this. Other schools might, so you might have it in your PT-CAS anyway. But when you're invited for an interview, that's when you'll have a chance to explain your experiences with the faculty that you're interviewing with. So the final slide here, steps in the application process, but you need to submit both applications by the deadline, either the October 1st or the March 3rd. This year it's March 3rd because March 1st is on a weekend. So PT-CAS requires it to be on a weekday. Make sure that your GRE scores, official transcripts, and letters of recommendation are received before or by the deadline. We will be inviting top applicants in each of our deadline periods for an in-person interview. The early deadline will happen in late October, and the regular deadline will be in late March or early April. And then admission offers will usually go out within about a week of the interview process, and then deposits will be due about a week after you get the admission letter. So that's kind of just a rough overview of how the process works. And now we can go ahead and open up if anybody has any questions. Actually, I guess Tom probably wants to stop the recording first, and then we'll get to questions if there are.